That's the meat and bones of the disability application in terms of proving disability. So it focuses on three things: your education, which is a direct factor in the disability analysis. There's different rules based on your level of education, depending on how old you are. Your work history. You know, part of the disability analysis is whether you can do the kind of work that you used to do, your past work, your past relevant work. So there, of course, they need to know what kind of work you used to do in order to assess and make a decision as to whether you can continue to do that kind of work. So they're going to ask about that. And then they're going to ask about your treatment, your medical treatment. So when they ask about your medical treatment, they're asking, you know, what are you diagnosed with? What kinds of doctors are you seeing? Your medical provider information. What kind of tests have you had? MRIs, echocardiograms, x-rays, lab work, you know, breathing tests if it's like an asthma or COPD is involved, that sort of thing. So they want to know who you've been treating with, when, you know, the start date, at least month and year, you know, the last appointment you had with that provider, what kind of tests, what kind of medications, have you been to the hospital, you know, what's the dates of the hospitalizations. This is important to get right because Social Security, as part of the application process, is going to be requesting all of your medical records. You give them authority to do that as part of your application process. You're asking for disability benefits, so you have to give them access to your medical records. So in order for them to get your medical records, you have to give them this correct information. So in summary, if you're planning to file for disability benefits, you can Google SSA Form 3368 and get familiar with the kinds of questions that they're asking so that you can prepare yourself